Good evening and welcome to each and every one of you who have logged in this evening. I welcome you to this webinar session, which is jointly organized by Indian Fertility Society Tamil Nadu chapter and Shield Connect. And we have a fantastic program this evening focusing on male infertility. We will have one talk by Dr. Gopinath on semen collection difficulties, which at times can be such a surprise, and it's important to deal with it. And how the ART Bill 2021, which has become an act now, is going to change the whole practice of intrauterine insemination. So Dr. Priya Kannan will enlighten us on that. So I would request you to share the CV of the chairperson. It is such a pleasure to welcome Dr. Ramani Devi. And I think we can just skip that slide.
Yes, skip this also, yeah.
This is for people to read and know about you. But I would love to say that she's one person who stands as a role model for so many women to come on the forefront, to be academically powerful. I mean, to you, I feel like I owe a lot of empowerment which we gain when we interact with you. So you're a powerful soul, not only for Trichy, but for the whole South India community. And maybe that's one reason we value you as an past Foxy Vice President. So without further delay, I hand over the proceedings of this evening to you, Ramani Devi Madam. So we will wait for you to introduce Dr. PM Gopinath sir. He is every day a role model for me. He was the one who brought me into this whole world of Indian Fertility Society. And I owe a lot of milestones in my life to Dr. Gopinath sir.
Thank you, Rajapriya, for making me a chairperson for this very important discussion by IFS on two important topics, that is difficulties in semen collection and as well as ART bill in IUI. See, I feel these two are very, very important, and I'm really privileged to introduce Dr. PM Gopinath, who is the president of IFS of India. And more than that, my association with Professor Gopinath was very, very long time, since I was an diploma student in OBGYN at Stanley Medical College. He was doing his MD at that time. Then now currently he is the director and senior consultant at SRM Institute of Medical Sciences, Chennai, president of Fertility Preservation Society of India, member International Fertility Preservation Society, chairman Board of Studies for Tamil Nadu and MGR Medical University, founder secretary of the IFS in Tamil Nadu chapter. And he has achieved so many things: FMMC, FICS, FICOG, MBA, Health Services and Management, specialty training in fertility preservations at Sheba Medical Center and Israel, former professor and OG at Madras Medical College and past president of Oxy, and awarded leading lights in ART awarded by IFS annual conference in Cochin in 2018, awarded Icon of the Year in IFS South India 2019. More than that, he's a very, very nice person to interact with, as well as like how Rajapriya told, he has been a role model for many of the youngsters. And I had the pleasure of having some sort of communication with Dr. Gopinath for quite some time. So with this introduction, I welcome Dr. Gopinath to deliver his talk on very important topic, that is semen collection difficulties. Because day in and out, for any infertile couple, we need to have the basic semen analysis. But if we ask the man to give a semen sample for evaluation, very often he finds it difficult. Maybe he feels shy, or sometimes in a new environment, he may not be able to do it. And they will very often say that they will collect the semen at home and then bring it. But we know there are a lot of issues when the person collects the semen at his house, and hence we prefer the semen to be collected in the premises. And similarly, when we are doing an IUI or an ART cycle, see, on the day of egg pickup, if the man is not able to collect his semen, then the whole thing becomes a waste. So it is always safer to have a semen sample that has been collected and kept frozen, in case if he is not able to give one sample on the day of IUI or ART. Now let us see what Professor Gopinath is going to say about the difficulties in semen collection and how we can overcome that. Over to Dr. Gopinath.
And thank you, dear Ramani, and thank you, Dr. Rajapriya, for having given me this opportunity to share my thoughts on this interesting subject. When I think in terms of male infertility, I always remember Professor Anne Jacquier, who was the guide for Dr. Pandian in Nottingham. He introduced me to her, and we have invited her to Oxy to give a talk here on her way to Australia, and now she's settled in Australia. She has written a book which everybody should read on male infertility, a clinical guide. And in that, there is a chapter she has written on clinical problems relating to the collection of semen sample. I had an opportunity to get trained in andrology under her in 1990 in Perth. With that, I will take you through an introduction, anatomy and physiology, different situations demanding the semen collection problems, solutions, some case scenarios, and we will conclude. If you look at that anatomy, so from the testis, you will see here, so it just enters into the head of the epididymis. From here, the tail of the epididymis converts itself into the vas, and then the vas goes into the inguinal canal, and then comes out of the inguinal canal. It is joined by seminal vesicles and prostatic gland to form the ejaculatory duct, which opens into the posterior part of the common urethra. And then from out, this is the tract with which we are just dealing with that. You see, we always think in terms of a HPO axis. The same way, there is an hypothalamo-pituitary testis axis. You will see that red line is an inhibitory pathway, and the green line is a stimulatory pathway. From the GnRH, you will see that there is an LH which stimulates the testosterone from the interstitial cells. And then it also stimulates FSH in the substance cellular cells, which is there in the seminiferous tubules to increase the spermatogenesis. So testosterone also has got an impact on the spermatogenesis, and it gives a negative feedback to the thing. This is the tract with which it is just going on. If you look at the spermatogenesis, you will see here that it all starts with the primordial cells and the primordial germ cells. From there, it just comes into the spermatogonium. And then there is a first meiotic division where it comes into the primary spermatid cells. From there, it just goes into the first meiotic division, again a secondary. And then from there, there is at the end of the second meiotic division, it gets an haploid as a spermatid, which grows as a mature sperm. So there is two processes which we have to remember. One is emission, and another one is ejaculation. To make it very short on this slide, emission begins with the contractions of the ductus deferens by moving the sperms towards the urethra, where it gets the secretion from the seminal vesicles, prostatic and bulbourethral, all of them join together. It mixes in the urethra, forming the semen. And ejaculation is the sympathetic impulse causing a rhythmic contractions of the smooth muscles with the ductus deferens into the urethra. In addition, the pudental nerve causes contractions of the ischiocavernous and bulbocavernous muscles, which compresses the base of the erectile penis, from where it results in the expulsion of the contents there. So the emission and ejaculation are the most important climacterics, and which results through the sympathetic innervation. If you look at the normal composition, spermatozoa is only about 2 to 5%, seminal is about 60 to 70, prostatic gland is about 25 to 30, bulbourethral, which is thing. I don't have to tell the august audience about the description and thing. And when you see the reference values, which was there from 2010 to 2011, you will see here there are a lot of changes which has taken place. With that, we come to know about it. The most important thing is before collection, we have to give certain important instructions to them. We have to avoid all sexual activity and no ejaculation, no masturbation for at least 2 to 3 days before. And but they should not be more than a week because it leads into a less active sperms. No smoking, drinking, or recreational drugs. Do not use any lubricants. Do not ejaculate into the condom unless it is provided by the lab. Sample should not be exposed to extremes of temperature, and then inform the doctor if any medications are taken. Another thing which we have to remember, you ask them to wash and dry the hands before and penis before collecting the sample. The container provided to collect the sample should have at least 75 times the volume of the expected. For example, if it is 1.5 ml is expected, give them about 100 ml wide mouth. So they ejaculate directly into a sterile container, and then they have to collect entire part, and then it should be kept upright in a plastic bag with the lid tightly closed. Time of the collection should be noted there. It should be transported to the lab at the body temperature, which is about 35 to 37, and it should be reaching the lab within 30 minutes. In case it has to be labeled properly, and they have to carry the ID. There are some difficulties in semen collection. For most of the men, it seems awkward to collect the semen in an unfamiliar environment away from home. Any interruptions or annoying sounds around the collection room will increase the difficulty in collection. You can remember always the man goes inside and somebody wants to do that, they go and keep knocking at the door, you will not be able to collect it. Some men cannot collect the semen just because there is a mental stress. On any particular given day, they will not be able to do it. Some men may face difficulty in collection because of the problems of erection. In some cases, the man is able to have an erection but unable to ejaculate. So these are all the issues which can happen. What are the possible solutions? The collection room provided by the laboratory should be an isolated place so that annoying sounds can be avoided. Place a do not disturb board to avoid interruptions during the collection. Inside the collection room, some nice pictures has to be posted to facilitate the semen collection procedure. The room provided by the laboratory should have a cot or a bed where the patient can bring their partner with them to collect it. And it should have an attached washroom that must be there in the collection room there. There are some remedies which can think of. Avoidance of the stress. Counseling may help men to overcome the stress-related difficulties there. You have to talk to them. We have to just counsel them. It is just a normal process where, and you tell them about 99.9% of them, collect them without any issues, and then talk to them. Some medicines, such as sildenafil, is given to improve the erection to overcome the erection-related difficulties. However, if you have a proper erection, if you are unable to ejaculate, in that is a situation, and the vibro ejaculators can help you. There are some simple vibro ejaculators, which I will just show you in the pictures to come, which will be helpful, and it should be kept as one of the components in the semen collection room. It is preferable to collect the semen in the laboratory, but if it is not possible, you can collect it at home. In that case, they have to bring the sample to the laboratory by meeting the body temperature within about 20 to 30 minutes, as I have mentioned it. If the collection exceeds 30 minutes, add a small volume of the culture medium into the collection container before collecting the sample. And here, the most important thing is there has to be a concern. In that concern, the undertaking has given by the husband saying that he has collected at the home and he is responsible for whatever regarding the ownership of the sperm, because we do not know how the sample has arrived. So he signs it, and when he is depositing it, and you have to maintain that log very carefully there. Generally, for the ovum pickup, the male partners are required to give a sample on the 7th day of the stimulation, and the semen freezing is done so that it will be used as a backup sample. So this will give them an assurance saying that they are not under stress. They don't have to definitely give a sample but on demand on that day. So this eases them and they are able to just give the sample on the pickup. So when we take a fresh sample, we'll be able to use it and discard the frozen sample. In case if they are not able to, then probably we'll be able to just take the frozen sample. So supposing there are some patients who may not be able to give a backup sample. If they do not give a backup sample, they should be asked to provide it on the day of the ovum pickup. And even before they attempt giving the sample, we have to give them all the instruction in case if they are not able, if they don't have a backup sample, in case if they don't give the sample, what are all the possible things you can do? One is you will freeze the oocyte, think about it later, or they can use the donor sperm, or they just discard that ovum and then decide about it later, or then you have to think in terms of doing a TISA at that time. For example, if the fourth option is there, that patient has to be seen by the anesthetist. It has to be under the required time of starvation. He has to have a bath and he should be ready for an admission. And all this has to be counseled in case if you don't have a sample in the backup when he is planned to just give it on the day of the pickup. So this is the non-toxic condom. See, the normal condom probably around 15 to 50 rupees, whereas the non-toxic condoms cost here nearly around 900 to 1,000 rupees. So if they have a nocturnal emissions like nightfall, you can use them to collect it while sleeping and then collect the semen and carry it to the laboratory. However, all the parameters cannot be tested because of the delay in transport there. The second thing I've just told you, I'll be showing you, this is the vibro ejaculators, which if they give it at the root of the penis, it produces a vibration and then aids in the ejaculation. Whereas the erection has to be normal. It does not cause erection. That's the most important thing. This is hardly about 2,000 to 3,000 rupees. It should be kept there and the patient has to be counseled where it is available. It should be available in semen collection. They cannot come out and tell us that I am having an erection, I am not able to ejaculate. In that case, it is a shameful the feel, and then there is a guilt for that man and he will not be able to collect it later. So initially you have to appraise them about what is happening, what is not happening, and then tell them. This is an electro-ejaculator. Here, if the prostatic massage also fails, you can just stimulate the prostatic gland by using a small probe inserted through the anus with the general anesthesia. The problem is it needs general anesthesia. Then you need this electro-ejaculator. And again, the quality of the sperms through an electro-ejaculation is definitely inferior to the ejaculated sperm or by a vibro-stimulated sperm sample. So this is quite expensive. Not everybody is using it. We use a vibro-stimulator. This is an equipment what we have in my hospital. The patient, there is a provision here to use a condom. And this is a special non-toxic condom. You just fill it up there. And then there are switches here which will give you the rhythmic contraction, which he can increase it or decrease it and increase the frequency. And there are some places where there is some video here which you'll be able to see and then collect the sample. The height is also adjustable according to the height of the person. This is a semen collection vibrator, what we use it in my hospital there. This is how the room looks neat, small couch is there, and then there are all the provisions are available and we explain to them there. Let us see some small, simple case scenarios there. Mr. D comes for the semen analysis, but was unable to collect the sample. The patient was given counseling and asked them to relax, go and have a cup of coffee, come back and try, saying that this is not the ultimatum. And then collecting the food or after having the food. So he comes out and then he is able to collect the sample. Semen analysis was performed, the report was given. Here, the most important thing is make him understand this is not the end of the tunnel. It is only the beginning. There are various available options are there if he is not able to give a sample. That will make him very clearly relax and just give the sample. This is a case study too, where Mr. A and his wife come for an IUI treatment, was unable to collect the semen sample. So counseling was given to them, patient to relax, relieve the stress and related difficulties. But the patient was unable to collect the semen sample. Therefore, semen collection device such as the vibro ejaculator was also used and the patient was able to produce the sample. The semen sample was prepared, IUI was done. Here, as I mentioned it, we tell them where exactly the aids are available for him to use it. And when he is doing, he should not come out and call you and say, I'm not able to do it. Can you give me the stimulator? Can you do that? So you explain to them in detail, and most of the people are able to collect it without any aid there. This is again a case study 3, where S and his wife has come for IVF treatment, was unable to collect the semen sample. The counseling was done to the patient, and also semen collection device was used as a vibro ejaculator was used. Even my own SIMS ejaculator was used. But the patient was unable to collect the sample even with all these efforts. So therefore, we counsel them, we advise them to do the collection on the day of the pickup, and he was not able to do it. Therefore, the TISA was performed on the day of the OPU, after the OPU, and the sperms were retrieved, ICSI was performed and got fertilized, good embryos were developed, and the couple is now waiting for an embryo transfer because we have gone for a PGS system. So to summarize the talk, solutions for difficulties in semen collection. If the semen collection is in the laboratories by masturbation, collection is successful, laboratory testing. And if he is unsuccessful collection and able to masturbate, and then there is a stress reduction, and then stress reduction, and then and again, if it fails, and then if there is an erection, and then you can use some inadequate erection is there, use some medication. If the erection is adequate, you go through the vibro ejaculators there. And if you see that unable to masturbate and then able to ejaculate with the vibro ejaculators, you can use it. Failing which, we can ask them to have a non-toxic condom and then do an intercourse and collect it. And if he is unable to masturbate, unable to ejaculate, then nocturnal emission can be given through a non-toxic condom. If it is successful, fine. If it is failing, you have to use a vibro ejaculator. And if it is successful, fine. If it fails, probably you have to check for post-masturbation urine again to see if there is a count. And if there is a count, then that can be used with the typical hot stick technique of diluting with the sodium bicarbonate. And here, if there is no sperms, even in the post-masturbation, then you can try for an electroejaculation. If it is successful, then we can use it for a suitable procedure. If it fails, then probably you have to just go in for a testicular biopsy. To conclude, semen analysis is an important, simple, non-invasive test. At times, it may evoke very stressful reaction and may cause difficulty. Adequate counseling and proper instructions are mandatory. It is, if there is a difficulty, suitable solutions has to be offered even before the patient comes and tells you that there is a difficulty. Make the man at ease and sort out things slowly. There is a way from a simple counseling and relaxation technique to sperm retrieval techniques available. The one size does not fit all. The patient has to be counseled and patient has to be put into appropriate track to make him at ease and then give a sample. Thank you very much for your patient listening. I thank the IFS Tamil Nadu chapter. I'm very proud to be a founder president, and I'm really happy to see it's going great guns.
Thank you, Dr. Gopinath, for your very crisp and clear topic on this difficulties in semen collection. I think you have discussed each and every nook and corner of the problems, whatever things we can face. And I have one question for you. how do you collect the semen for paraplegic men? See, usually they say that for a paraplegic men, you have to use it for electro-ejaculators. Have you had any experience?
We have used an electro-ejaculator, but usually paraplegic men, you have to use an electric ejaculator, collect it, discard it. After a week, again, we have to use it, take it, and then try to use it. Usually, the problems is all of them will be asthenospermic.
Yes.
The motility will be very, very poor after the electro-ejaculation. If they are taken up for assisted reproductive techniques, it will be fine.
Then one more thing is, see, sometimes we see the patient collects the first sample collection may not be good. He will have very few sperms and they are very, immotile with abnormal morphology. But if the same person, if we ask them to collect after 3 or 4 hours, or the next day morning, we get a very good quality of sperms and the good in number. So does really abstinence plays a major role in assessing the semen parameters?
Now here, if you go back to the physiology, I have mentioned it, there is a process of emission and there is a process of ejaculation. What has been completed the emission must have been a very old sperm. When they get ejaculated, you get a poor sample. So in that case, in that scenario, it is very, very useful to have a second. Sometimes even in our ART lab, we come across people who give a sample. When it is poor, we ask them to go around, have a cup of coffee and give a second sample. And
Yes.
second sample will be very good. That is mainly because whatever has been, a process of emission has been completed, has been an old sperm.
I have recently one couple, and the boy, the man rather, is of a very low IQ, like practically not much knowledge about sexual act. They married almost 2 years. But there's a denial from the mothers that such a situation is happening. They only think it's a semen collection difficulty, but it's sexual.
Always the mothers deny.
Absolutely. In this situation, I'm actually putting across through a psychosexual counselor. They've almost gone through 2 sessions. And the counselor is also finding it very hard because IQ is low beyond the sexual knowledge aspect. So in this kind of a situation, what would be your suggestion, sir?
No, it looks upon the age of the female partner, the marital time, both put together. If you take a chance, then probably you can go in for a teaser directly. So I have done in a couple of cases, the cases where we are not able to collect it, we counsel them and then we do it. I have a patient who recently I have done it. He is on psychotic drugs and he is completely not aware about the procedure and he is not able to collect the sample. He is not cooperative. But somehow or other, he just came for a teaser. We did a teaser and then did an ICSI and delivered a twin to them. So they're quite happy. Even then, now the wife, it's about 9 months since they have delivered. The wife says he is not making any effort to have any sexual activity.
That's right, sir. But actually, they get very good wives. So the first question I ask the wife is, are you okay with whatever is happening? Because if you're not okay with it, it's time for you to think about the future.
Separation,
But
yes.
she's very clear. I like him. I'm fine with whatever is happening. It's only that we are trying to get a baby. I don't know. He's going for a job also. His knowledge level is pretty on the difficult side. So we were also discussing about semen freezing as an option pre-OPU. So generally, how long, sir, you tell them to give a consent before the sample? I mean, and do you also take a consent like post-procedure, this would be discarded? Are those put in a separate consent?
You mean for fertility preservation?
No, sir, for pre-OPU semen freezing as a backup.
See, usually I take it on the 7th day. Second day we start the stimulation. The next time when they come there, they do the 7th day. Once when we know that the follicles are growing, then we put them for the anesthetic assessment that day. And then we ask them to give a backup sample and then give a consent sign saying that it is only a backup sample which will be discarded if the fresh sample is given.
Okay. So it has a deadline. So it's safer for us to take a date and make them understand it would be discarded.
Correct.
Yes.
So I just wanted to, because I think with the ART bill coming up, everything going into writing and them not accusing that we used or misused that sample, all this becomes important if we pen it down.
The more you read about the ART bill, I think we have to change the profession to lawyer.
Or we ourselves should have finished some medical legal law.
Maybe it will become an additional subject, madam, instead of studying forensic science and certain other subjects which we actually don't know why we studied in MBBS. A little few hours devoted to medical legal defensive practice and understanding law becomes important. But I guess the way forward is regulations in any forum we are into. So the second ejaculate comment was something I was looking forward for, because as it is for them to give one sample, it's such a collection difficulty. So what are the situations where we need to educate them that a second ejaculate may be necessary, sir? Especially for pre-ICSI, they always say a second ejaculate is what the embryologist will be happy with. So this group of patients, would you offer a sildenafil ahead of time?
No, see, again, there is an issue. One is unable to have an erection and unable to have an ejaculation. If there is an erection difficulty is there, I use them sildenafil citrate. If they are having a good erection, unable to ejaculate, then use a vibrostimulator. So this is way in which you have to just differentiate it.
The second ejaculate.
And in case if there is a premature ejaculation where he is not able to control, then you have to use depoxetine and sildenafil citrate.
Yes.
Thank you. Thank you, sir.
Thank you, sir. Okay, the next speaker is Dr. Priya Kannan, who's the Director in Clinical Embryology, Garparak Shambhiya Fertility Center, and past President of Association of Clinical Embryologists of India. And she has several chapters to her credit that has been published in the books as well as in the journals. Over to Dr. Priya Kannan.
Thank you, madam. Thank you for the kind introduction. And I would like to thank Tamil Nadu chapter of IFS for giving me this opportunity. I'll just start sharing my screen.
One thing is, everybody knows that people who are doing ART, they know some rules and regulations and follow it to some extent. But whereas in small nook and corner of even a smaller hospitals, everybody keeps doing IUI. Is there any regulation? Is there any ART bill that will have an impact upon this IUI practice? I think it will be an eye-opener for the peripheral doctors also, or doctors who are doing only IUI. I think Dr. Priya Kannan will be able to give us some insight regarding this particular problem.
Thank you, madam. That was a very interesting topic, because while with the ART law coming in, it is no more a bill, it's a law. It's been implemented, and since Jan 25th of 2022, it is enforced, and hence we have to comply with it. But while, yes, there are some time by which we have to do, because they are yet to set up certain things. While we've been talking ever since it has been introduced, we've been talking about surrogacy or donor oocyte and donor sperm and embryo donation and everything. This is an interesting aspect of what I had to look at, how it is going to affect IUI practice. So first of all, to know whether does IUI come under ART law. The first thing is, how does the law define assisted reproductive technology? It defines it as means all techniques that attempt to obtain by handling the sperm or the oocyte outside of the human body and transferring the gamete or the embryo into the reproductive system of a woman. So which means IUI is definitely under the ambit of the ART law, because we are handling the sperm outside of the body, processing it, and then keeping it back into the uterus of the woman, and hence it is under the ambit of the ART law. So these are all the four bodies that are going to be governing us. So they're all yet to be established, but I'm sure most of us would have been registered under the PCPNDT of the respective district right by now. But then these are the 4 bodies which are going to be set up. That will, the National Assisted Reproductive Technology and the Surrogacy Board is the one which will oversee the implementation of the law. The National Assisted Reproductive Technology and Surrogacy Registry is where all our details, the number of cycles, to the history of the patients, to everything we have, the data will be transferred to. State Assisted Reproductive Technology and Surrogacy Board is what will be giving us, will be implementing that law in the state, and there will be an appropriate assisted reproductive technology and surrogacy authority in each state. So these are all the people who are going to be implementing, regulating the law, and hence regulating us in turn. So far, there has been no regulation in terms of any setup of an IUI center. Nobody has registered themselves anywhere. But right now, just a second, I'm just going to, yes, that makes it better for me. My view was blocking. So now, what does the ART law say in terms of an IUI starting, or even for an established IUI center as well? No person shall establish any clinic or a bank for undertaking assisted reproductive technology. And remember, IUI is an assisted reproductive technology as per the, and comes under the ambit of the ART law, or to render the ART procedures in any form unless such a clinic or a bank is duly registered under this act. So which means every IUI clinic, wherever, any single clinic, single doctor clinic also, which is performing the procedure of IUI, has to be registered with the appropriate authority of the state for, and only after that they can start doing it. So that is for a new clinic. So what about the older established clinics who are already doing it? So any clinic or a bank which is conducting ART procedures, they have to apply for the registration within a period of 60 days from the date of establishment of the National Registry. So if you're starting a IUI clinic after the law, after the registry is established, you have to register first, and then only, just like our scan centers. No scan center can be, is allowed to perform or work without the PCPNDT license. The same way, without having the license, ART license, no IUI clinic can be started henceforth. For the established or the ones which are already functioning, you have to go ahead and apply for the registration within 60 days of the formation of the registry. And of course, the registry, the registration is only for 5 years, just like PCPNDT, and you have to renew every year. So in terms of selection, what is the responsibility that the ART law has given to us? Number one is the selection of patients. We cannot do any ART procedure, and IUI included, on any woman who is less than 21 years or more than 50 years. So the woman has to be more than 21 years and less than 50 years for any ART procedure. The same way, the man has to be also more than 21 years and less than 50 years. Both these have to be complied when you're selecting the couple for doing the ART procedure. And the clinic and the bank shall ensure that the commissioning couple and the woman and the donor of gametes are eligible. The eligibility of the patient, we have to take the onus of selecting the right patient to go through. If somebody comes at the age of 20, they've been married for 3 years or 25 years also, we still cannot go ahead and do an ART procedure unless the woman is more than 25 years old and the male partner is also more than 21 years old. And of course, if the female is about 45 years and the male is about 57 years, still we cannot do, because the male partner's age is more than the age allowed by the ART law. And what about the donor gametes? The clinics shall obtain donor gametes from the banks. The banks are yet to be established in terms of the ART law, but there are already banks available. So we have to take it only from the banks. And it is a duty of the bank to ensure that the donor is medically tested as prescribed. We assume that it is by the ICMR, but what they have to medically test, I think the law is yet to give us the information on it. The clinic and the bank shall ensure that the information about the commissioning couple, the woman and the donors shall be kept confidential, and the information about the treatment shall not be disclosed to anyone except the database to be maintained by the National Registry, except in the case of a medical emergency at the request of the commissioning couple to whom the information relates, or by order of a competent court of a competent jurisdiction. So this is very clear, and it again goes to show that we have to do donor insemination or donor gametes, may be oocyte or the sperm, by confidentiality. And hence, I presume that we still have to go ahead and do only anonymous donors. We cannot do related donors either for egg or for sperms. And for every procedure, we are supposed to issue a discharge certificate stating the details of the ART procedure that has been performed by the on the couple or the woman. So for the donor oocyte, again, you have to give them a different discharge summary. If you're doing an IUI, every IUI has to go with an IUI report or a discharge summary, which states clearly all the thing, what the procedure the patient went through and how it is and everything. It is important that the discharge summary is given, or a discharge certificate is given to the patient at the end of each ART procedure. The clinic or the banks shall not cryopreserve any embryo or a gamete without specific instructions and the consent in writing from all the parties of the ART, seeking the ART technology. So I think that is important. We cannot store any sample without the written consent of the male or the female partner. In terms of IUI, it's mostly the male partner. So as Sir was discussing about when you get a consent for the backup semen sample, also we have to get a consent from the couple stating that this particular sample is being taken up as a backup sample for IUI or IVF, and hence, and whatever, it will be thrown 6 months from the date of storage or right after the procedure, or whichever has to be stated clearly in the consent form. And in terms of record maintenance, it is entirely the onus has been given to us, the clinics and the banks, to maintain the record. The law states that all clinics and banks shall maintain detailed records of all donor oocytes, sperms and embryo used or unused, the manner and the technique of their use in such a manner as been prescribed. That detail is yet to come, but we have to maintain what we have to know right now is we have to maintain the details of the number of donor oocytes we've used, what happened to the oocytes, how many sperms you've got from the bank for the donor sperms, and how they were used, where they used or discarded or given back. Whichever it is, we have to maintain the record. For how long do we have to maintain the record? The record has to be maintained for at least a period of 10 years, upon the expiry of which the clinic and the bank shall transfer the records to the central database, which is the National Registry. So are there any stipulations in terms of using donor gametes? One thing is you can't have donor gametes. I have seen some clinics get about 10 samples of donor semen from a bank and keep it with them. I'm not sure if that might be allowed, because each sample that you procure has to go into their registry and our registry of for whom we are procuring that sample and keeping it. The purpose of, we have to mention the purpose of each gamete, donor gamete that we are procuring from. So that may not happen from now on. We have to procure every time there is a patient for that particular patient only. A woman shall not be treated with the gametes or embryos derived from more than one man or woman during any one treatment cycle, which means if you are using double insemination technique for a woman in an IUI, you will have to ensure with the IUI, the semen bank, that they give the same sample both the first time and the second time. This goes again with that line which is given that a bank shall not supply the sperm or a gamete of a single donor to more than one commissioning couple. So that if one person has donated and one of the samples has gone in for the first insemination of women, if there are samples left, it cannot be used for any other couple and has to be used only for that particular. So when we are asking for the second sample, we will have to ensure and make sure or request such that we get the same sample as the first insemination that we have done. The clinic shall never mix semen from two individuals for the procedure specified under the ART Act bill. The collection of the gametes posthumously shall be done only if prior consent of the commissioning couple is available. In terms of gender selection, it is been stated in black and white again in this law that it is prohibited for anyone to do the act at any stage to determine the sex of a child to be born through the process of ART, or to separate or yield fractions of the semen which can be enriched with X or Y variations. So that is not permitted as well, which was never permitted, but they have put it in black and white here. In terms of sale, import or export of gametes, the sale, transfer or use of gametes, zygotes, embryos or any part directly or indirectly to any part within or outside India shall be prohibited except in the case of transfer of own gametes and embryo for personal use, but with the permission of the national board. We cannot use or sell or gametes, zygotes or embryos within or outside India, except for a personal use of the patient only. If like the patient can transfer their own gametes and embryos, but you cannot transfer donor gametes or donor embryos for the sake of any gamete or embryo for the sake of donation. So just a bit on the penalty, it's quite a lot, but then I thought this was quite different and I thought I'll mention it here. It is mentioned in the law that any medical geneticist, gynecologist or RMP or any person shall not abandon, disown or exploit or cause to be abandoned, disowned or exploited in any form the child or children born through ART. I'm exactly not sure about how we would abandon the child or anything born through ART. So this is something we should be aware with. So, and any child, we are not allowed to disown or abandon. It is outside my thought about this, except in terms of surrogacy. I don't think it comes under the ambit, but this is not mentioned only in the surrogacy law. This has been mentioned in the ART law as well. So we must take this into consideration. Remember this. What is the punishment for this? The punishable with the fine, which may not be less than 5 lakhs, but may extend to 10 lakhs for the first time. The second time, there will be an imprisonment for a term not less than 3 years. If it's more than that, there can be extension of the term to 8 years with a fine not less than 10 lakhs and may extend up to 20 lakhs. That is one. The second is not to use any intermediates to obtain gamete donors or purchase gamete donors. So the use of intermediates has been prohibited in this, and we have to approach only the banks to take this. So when we all know that in an IVF center, there are so many people working under us. So who will be held responsible if there is some wrong which happens inadvertently or advertently, whichever? The onus has been fixed on the executive head of such clinic or bank shall be deemed to be guilty of an offense unless and otherwise he proves that the offense was committed without his or her knowledge, or that he has exercised all due diligence to prevent the commissioning of such offense. So the first person who comes to the law's mind is the executive head of that clinic or the center, and only if that person is able to prove that he or she is not responsible for it and has taken enough precautions to prevent such such mistakes, would that person be let off. It is the onus is on the person. It is not that the person is not guilty until proved. Here the person is guilty until he disproves that proves that he is not guilty. So it's time for caution for all of us to make sure that we have systems and protocols in place to ensure that no mistakes happen. So that is in a very small nutshell of the things I thought will make a difference in IUI practice. Of course, in IVF, there are more to be talked about, but in IUI, these would change a little bit about how we do IUI now. The most important being registering of the IUI clinic. Thank you very much for this opportunity.
Thank you, Priya, for your very short, but at the same time, very crisp talk on how an IUI laboratory should function. I think you have mentioned everything because the handling of only the sperms, that also comes under ART bill. And that is what is done in IUI laboratories. And they should also be registered with the ART registry. And again, when you are doing a donor sperm IUI, you have to be more careful, and the sample should be obtained only from prescribed or registered banks. So these are all some of the important things, and how long we need to maintain the registry and how to maintain the secrecy, or rather the see what is it?
The identity of the donor.
Identity of the
anonymous
donor
donation.
should not be anonymous donor, should be maintained, should not be revealed. And again, this basic who owns the responsibility. It is again falls on the owners of the
executive head of the center.
Executive head, that is the owner of that particular center, because that is very, very essential, because without our knowledge, sometimes something can go wrong. And we should be aware of what is happening in all this IUI laboratories.
Priya, you have one question where January 25th, you said the act has come, the law has happened. So from when do these regulations start getting implemented? Is one question.
And it is given, they have given themselves time of what, 6 months.
6 months. So
yeah,
the registration will start 6 months later, like from Jan 25th means maybe by July or August. The particular.
They should have the registry in place. That's the first thing. They should have the board and then the registry in place. And that is when we can actually start contributing to that.
Yes. So at this point, people can continue to do what they are doing as of now.
Yeah.
They can continue to do what they are doing within the ambits of the law.
So
okay, Priya,
yes.
One thing, it will be beneficial to all the Mofasal people who are doing IUIs, if you can put in the ART, how it should be registered to that of the ART centers registry.
Ma'am, as of now, we don't have we don't know how to apply to them as such.
Yes.
Even here, we don't know how to apply to them. But something we have been doing is register ourselves with the PCP entity. That is, we all have a PCP entity license number for both, one for scan and one for ART. That's what we had. But for this national registry and the national board, we yet do not have the guidelines of how to, we don't even know how the application looks like. It has not yet been published as so far. So that is what they are asking. The law itself has given themselves, the government, 6 months to establish the board, registry, and the state appropriate authority.
So as on date, it is only in the fluid state.
I think
So
As of now, our PCP entity is the legal authority to take action on us.
I think in a lot of these meetings, my understanding is the national board is probably going to be in the lines of ICMR, and the state board is going to be in the lines of the DMS PCP entity. So as you rightly said, trying to apply to the PCP entity DMS license is one way of getting into some form of registry.
Yes.
So we can as well start right now. You can go to your respective PCP, whoever, like in Trichy, it will not be the DMS, is the JD. So they can apply to each district will have their JD. They can go to the JD and start applying there. So here, whoever is in the Chennai can go to the DMS office and do. As you are applying for your scan license, the same way there is a license from there, the same office for registering into the ART. So you can start registering yourself into as a IUI clinic alone.
Okay.
Now, ma'am, do you think we need to get a donor? See, normally in a Semen bank, we ask for the donor sample and go ahead. Do you think from henceforth we should get the details of the donor and put it into the file as well, so that we know that next time we ask?
We usually do get it from the we get it like, we don't get the identity of the donor, but we get that the donor has been screened for all these diseases, and this is the color of the person, this is the build of the person. All those things are mentioned already when we are procuring from the bank.
Like the new bill says 1-to-1. So the one donor for one couple.
Yeah.
Yes.
And to be able to retrieve the same sample, it is safer for us to keep a record. So when we are asking for the from the bank again, we can quote the
that we would have that vial number. No?
number.
We have to quote the same vial number and say, I want this.
All these smaller things get into more importance.
Yes.
Able to track back. And what's your opinion about a single woman or a LGBT related approach for becoming a parent?
So far I'm not sure what the bill has got into it. It doesn't mention much about as of now. I don't think it is given for any of the LGBT couples. It's not specifically mentioned for LGBT couples or even for single women to get donation.
But the widow is mentioned. The widow is mentioned. The widow can go for IUI.
Yes. But I think any day a single woman will be allowed because they are also allowed to go for adoption.
So
all this goes hand in hand with the adoption law. So when they allow a single man to adopt, they will allow this also.
Again, the distance between the prepared sample and all that, probably each zone will have a distance, right? Because we want a particular sample within a particular period of time. And all this is going to decide, like the clinic and the bank can be under the same premises. All these are going to unfold once the policies come in place.
Sure, it can, but then it is always preferred that the sample is processed and prepared at the site of IUI, and a prepared sample should not travel because a prepared sample to travel is not good. So any sample that is a frozen sample is transferred to the IUI clinic and the processing happens at the IUI clinic.
So do you think this is once the enforcement comes in and we all get truly answerable to the law one day, you cannot no longer go give your semen sample somewhere, get it processed and then get it into some clinic and do it? That's not going to be happening after August. Unless
both the centers are registered, and but then if you go somewhere and do it and they are sending the sample out, then that will, I think it will imply some paperwork, as it's rightly said, you can transfer the sample, your own sample from one place to another, but it has to have a paperwork. So collecting one sample somewhere and then processing it elsewhere may not be the right way to go. Wherever the IUI clinic is, that is where the sample should be given and processed.
But that does not come into the details of the bill, right? That the self-semen processing should happen under the same premises.
It's not, but I don't know how, like it might say like, going from one place to another of the scan has to have all the things here. You don't know how the intricacies has not been lined as yet, but this is a general picture they've given.
Yeah, but and as Ramani ma'am, I think like for PCPNDT, every month we send a report that we've done so many scans and all that. This also involves the same exercise. Every month we have to send a report, right? I have done for this many patients.
Actually, it is already in vogue. We are already sending a report. Yeah. For everything. That ART gives everything, all procedures included IVF, IUI, IVF, ICSI, FETs, everything we send. To the same PCPNDT office.
Yes.
Yeah, they sent us a model like a few months ago. So we started sending in from this month.
So they've just started that process.
I don't know. Apparently I didn't know how to fill that form. So I spoke to Kundave madam and got the info about how to fill the form. So, but they've been doing for quite some time.
Okay. So because we had a recent PCPNDT DMS inspection and renewal. Nobody had asked. Show me.
They don't know. They don't know much about this.
So actually, certain things are such gray areas.
No, the thing is, they are not ART people. They won't know much.
Absolutely, but then we are sending it to who and who's actually having a look, or who's
nobody even looks at our scan data. So
anyway, but it does go to the same address. Your report of
the same address. I sent it along with my scan report only.
Okay. So maybe that's something new I have learned from talking to you today. Any further questions, Ramani ma'am?
Ma'am had messaged that she had to go.
Questions in the chat box. So if ma'am is, she's got a call from the labor room.
Labor room, so madam had to go.
So shall we continue IUI? In case of IUI and anesthesia, we have to work on some format. I mean,
no, not at all. I don't think IUI and anesthesia and a regular IUI has got any difference. It is just that we have to comply with the IUI regulations as per the ART law. IUI with anesthesia and doesn't matter at all. And there is one again, shall we continue IUI till the regulations come over? Ma'am, please go continue IUI. You can continue even after regulations have come over. But I suggest that you start registering, you apply to register your clinic with your local PCPNDT office so that you won't have a trouble once the law sets in. So I strongly recommend to everyone to go ahead and start applying for the to the PCPNDT office to register your clinics as IUI clinics.
Especially, I think there's a lot of caution to be taken if they are getting involved in third party, which is donor IUI. And I think we hardly have any registered Semen banks except one or two, right?
Access. I don't even know any registered Semen bank. We just take it from a bank.
We have to just ensure are you registered. Give me that detail so that we get safer in future.
Yes, absolutely.
So it looks like there's a lot of paperwork, and that's what the 6 months waiting time is for, to put things in order. No?
Yeah, true.
So that was lovely, Priya, having a lot of chat. And I think we put across the message to a lot of regular gynecologists practicing IUI because it's one of the simplest, cheapest fertility treatment tool available. But I guess it may not be that simple or that cheap in future. But at end of the day, a regulation is to make a practice more refined, more legal, more ethical, and more transparent for the couple. And I guess that is something we all have to look at as a welcoming change and be prepared for it. So thank you so much, Dr. Priya. It was lovely to have Dr. Ramani Devi and Dr. Gopinath sir as part of this program as well. And a very special thanks to Shield Pharma, who has made this evening possible, and for the great audience who have been interacting with us. And I guess there's one more question. You want to take that, Priya?
Sure, absolutely. Sorry, I didn't notice.
In
ICMR website, there is no registered bank. Exactly. That's except clinics. There are no banks registered as of now. But yes, we've been taking from banks. But I guess because the ICMR as such has got no legal authority to register either the clinics or the banks. And that is per se why they stopped giving us any numbers at all. You would remember that there was a rage to go ahead and do it, but then now they stopped a while ago. I remember talking to Dr. Sharma some time ago, like long ago, 5-6 years ago. He said we don't have any legal authority, so we are stopping it right now. So they don't have any legal authority, but in 6 months' time, we will have somebody who's got the legal authority. But right now, to register the clinics, PCPNDT is the legal authority. So just get it done.
I guess at this point, only 1 in 1,000 clinics would be registered for IUI procedure.
Maybe, yes. All the ART are almost registered.
Yes, I'm saying 100,000 centers practicing insemination today are registered.
Yes.
So everyone has to decide what is the they can look up in the ICMR website, right, to know the requirements for doing an IUI, the infrastructure essentials, the lab essentials, because that is something we have to produce. You need to have that when you're doing the IUI procedure.
Hopefully they will take the ICMR guidelines. If not, they will have a body to decide on the guidelines. But I think to make their life easier, they will take the 2014 ICMR guidelines. And the ART bill is a replica of that. So they will take probably that and work on it, I guess.
So as you rightly said, I think we can conclude this session saying that the ICMR 2014 guidelines, giving them a guidance on the infrastructure, the personnel is essential, the equipment essential to get the IUI procedure to be done as a level 1 center, and they can approach their local PCPNDT body to register themselves as an IUI clinic. So that's for those who are serious about doing a good volume of IUI. So thank you so much to each and every one of you.
Thank you again.
And lovely interaction. And I guess every time we have to use every opportunity to learn more about the ART law.
Yes.
And to keep ourselves safe. No offense, no penalties. Thank you.
Thank you. Thank you so much for inviting me again.
Thank you, Mr. Naresh and Chitrakala, the two great names of Shield Pharma, which I'm associated with. So looking forward to regular programs with all of you.
Thank you. Thank you so much, ma'am.
All right. So I sign off as well. Have we logged up?